I'm Dr. Anthony Maloof, advisor in faces and corneal oculoplastic surgery, and welcome to this video on DCR surgery and something called sump syndrome. Now, the reason I'm making this may be more clinical than patient-oriented, but patients may benefit. In watery eye surgery, we talk about something called sump syndrome all the time, and it doesn't make any sense to me. And I'll try and explain why it doesn't make any sense, and I'll explain to you why something that I call reverse sump syndrome makes sense. I won't just explain it to you, I'll show you a patient with the problem. So just to remind you what DCR surgery is, it's dacriocystorhinostomy, basically a big word for making a hole between the tear drain here and the nose so tears can drain out and you don't get watery eye. Seems conceptually straightforward, and it is. However, here's the tear drain. If you have a look here, what we do is we open zone 2 and connect it to the nose. We bypass zone 3, and zone 1, which drains the tears from the eyes, remains intact. So the zone 1 drains into this opening at zone 2, which goes straight into the nose, and that's a dacriocystorhinostomy. All right, looks like this. Here it is. So we've opened up the tear drain and it drains straight into the nose. Tears go from the eye into the nose, and that's a functioning dacriocystorhinostomy. So in the literature, we talk about sump syndrome, and it always baffled me. As a trainee and even afterwards, I thought, what's going on? And it was used to explain people having a watery eye. I'll show you what it is. Here it says, we talked about it as having an incomplete opening so that water would build up. But that wouldn't cause a watery eye. Tears would drain directly into the nose anyway, despite that fluid level be there, because gravity keeps it below the opening of the tear drain. If it's below the opening of the tear drain, it won't cause a problem. It would just spill over and be absorbed. So it never made any sense, and I never ever saw it surgically afterwards. I've never seen it. What I have seen is the reverse. Hence, I call it reverse sump syndrome. And this is a problem and why people after a dacriocystorhinostomy come back and complain of watery eye. A membrane will form over the upper part of the tear sac and fluid will accumulate there, and the fluid acts like a plug over the tear drain. I call that reverse sump syndrome because it's not a sump, it's an upside down sump. So how does the water stay there? Very simple, surface tension. It's like a bubble. It's a meniscus. Is it real? Well, let's have a look. Here's a patient of mine who did DCR. She was asymptomatic, but she had slow tear drainage. And when I start this video, have a look. You'll see that there's a bit of yellow dye right at the top of a little crevasse. And that's where the common canaliculus opens. But her tear drainage is slow because the fluid there acts like a plug. Here we go. So have a look inside the nose. So there's a little bit of slow drainage going on here. Go up through the nose. She's early out of DCR surgery. She's already formed a fold there, and you can see in the upper left, there's green dye. So technically, she's Jones 1 positive, tears flowing, and she's pumping. You can see the pumping every time she blinks, but the opening is right up high and it doesn't conduct properly. I call that reverse sump syndrome. The treatment is not too difficult. All I do is go back to surgery and remove that fold, and it drains better. So it's not too difficult a procedure. That fold is part of wound healing, and there's variable wound healing. That's why it's also important when we do this surgery to make sure we clear the top of the common canaliculus to minimize the risk that this reverse sump syndrome can develop. Well, I hope that all makes sense. Reverse sump syndrome is real. It's not in the literature. Yes, I've given it that name, and I feel very comfortable doing so without it being in the literature. It gives me direction. It allows me to explain to the patient why they still have watery eye post-surgery, and it also allows me to fix the problem. So if you have any queries, send us a comment or an email. I'm Dr. Anthony Maloof, advisor in faces and corneal oculoplastic surgery in Sydney, and thank you for watching.